My favorite thing is to see just how crazy some of these medications work. My name is Blake Young. I'm the pharmacy director here at Vital Care of Chattanooga. So basically my job entails doing all the operational side of things, but then also filling medications and stuff too. So typical pharmacist stuff, but also having to look more into the revenue side, kind of see where our new streams can come from and things like that. Vital Care, what it is it's mostly a home infusion pharmacy, but we do a lot of compounding. So it's not all home infusion. Some of it is specialty pharmacy. So we do a lot of like the asthma medications that are injectables. We do some of the diabetes medications and stuff like that as well. But a lot of IV medications, that'd be like Remicade and Flectra. We do tons of those. We also do IV antibiotics. So yeah, just kind of around the board there. Home infusion is going to be for those patients that they're not really sick enough to stay in the hospital, stuff like that, or their condition doesn't require going to a hospital or an infusion suite. So if they're able to and they want to, they can get their infusion in their home. So it makes it a little more comfortable for them. They don't have to actually get out, get ready or anything like that. What we do is we usually compound the medication here, send it to their house, usually the day of, a few hours before. Nurse arrives, they kind of take care of all that. And we send all the supplies. So they'll have all the catheters, the infusion lines, everything that they need. Nurse sets it all up for them. Nurse will stay with them the entire time. They'll disconnect it. They usually stay with them about an hour after the infusion too, just to see how they do afterwards. So. Compounding is different things. So what we do is sterile compounding, which is a little different than what most people think of as compounding. So most compounding is going to be, going to a local pharmacy, doing like creams, especially like hormonal creams or hormonal tablets and stuff like that, capsules, things like that. We do it a little different. Here we do sterile compounding. So we have a clean room. And what you do is you have to go in, gown up, kind of looks almost kind of like a hazmat suit, not exactly that detailed, but once you get gowned up, you'll go in there, you have a sterile hood, so you have to clean it and everything. And usually you'll have like maybe an IV bag, normal saline, something like that. Sometimes it's just a vial of something and you're trying to mix it usually. So it's not compounding in the sense that we're usually making something brand new. We're usually trying to mix something according to the FDA label, that kind of thing. It was funny, I always wanted to do regular compounding when I went to pharmacy school. I like making your creams, your capsules, all that stuff. Took compounding, of course, in school. Absolutely hated it, realized that was not for me. Was not gonna make a living doing that. And so decided I wanted to go more the residency route, do hospital pharmacy. Up until my fourth year, decided that was what I was going to do. Fourth year, I realized didn't even want to do residency. I was ready to just get out and work. So I ended up skipping that totally, going straight into retail. Started as a manager at Walgreens, then became a manager at CVS. Did that for a few years. And then seeing this opportunity pop up, I was working on my MBA at the time too. So I was halfway through it, applied for this, and they were looking for somebody that was really more along the lines business oriented, not just a pharmacist, but could kind of do both. And applied for it kind of on a whim. I had done some of this in pharmacy school on some rotations. So I was like, I loved the sterile compounding, which most people don't like because you have to get gowned up and go in the clean room and all that, but I loved it. And I was like, I think that's the kind of compounding I want to do. So I applied for it on a whim, ended up doing tons of interviews, got the job, and then just kind of ended up here one day. The first time we fill the medication, I personally will take it to them, actually sit down with them, go over the medication. So you really get to know the patients. So part of what we do a little bit different too is, every month we follow up with them. It's not just, oh, I'm refilling it. We have a whole set of questions we ask, try to go over it, making sure they're not having side effects, trying to make sure they're doing okay and they have everything they need. So you really get to know them a lot more than even, regular retail side. And so that's been nice, but yeah, definitely have to be people oriented to make it happen because, you're talking to them one-on-one all the time. So I think people would be surprised at how complicated it is with the insurance companies a lot of times. For the most part, and you kind of know I have to go to CVS or Walgreens. Here, it's a little different. A lot of times we can bill their insurance through the major medical side if they come into the suite or something. here, but a lot of times it'll be carved out to random pharmacies nobody's ever heard of, and the patients they didn't know that that was an option. And then you have to tell the doctor, we can't do it. It has to go to this specific pharmacy, and they've never heard of it. And it might be in Arizona, and they're trying to find a pharmacy here that they can just use their suite to infuse the patient. And I think it would be just how complicated sometimes it can be with the insurances trying to get all of that squared away for the patient. My favorite thing is to see just how crazy some of these medications work. I mean, like, we've had patients that their arthritis was just absolutely horrible, and even after one treatment, they are just like, it's like a total 180. I mean, just the amount of improvement they can have just one time. And so it's been great to see them and see how excited they get. So I would say that's probably my favorite thing to see. We are more.